DNA is not destiny. There are lots of people who have so-called risky genes, bad genes, and nothing unfortunate that the gene would have predicted will ever happen to them. The biggest risk factor for cancers remains, and after is consistency is really key to performance. You've got to have some routines and rituals that help you keep an even baseline in a world where there's lots of ups and downs. Cancer is loss of control. I was in charge of my body and now it's rebelling. And I'm an adult. Everyone is bossing you around and treating you like a child. So I love the act of rebellion.
Hello, and welcome to Decoding High Performance, the podcast where we go beyond highlight reels to uncover what it truly takes to lead, sustain, and inspire excellence. Today, we're marking Breast Cancer Awareness Month with a conversation that blends medical expertise, prevention strategies, and the habits that keep us at our best. Dr. Stephen Tucker is a medical oncologist and a health futurist. He's also the founder of Tucker Medical, based right here in Singapore. He spent decades guiding patients through the realities of breast and prostate cancer, whilst championing prevention, lifestyle medication, as well as using cutting-edge technological innovation to support our health. I'm really excited to bring Dr. Stephen Tucker here. Join me and welcome.
Thank you. Thanks, Nina. Glad to be here.
Thank you. I'm so glad that we met at the Ice Bath Club the other day, because if not, I don't actually think we'll be having such a beautiful conversation today.
Well, it's taken some time to get to know each other, and it's good to have more clothes on than less, like the Ice Bath Club. But Ice Bath has been a great way to meet a lot of people, and there's a lot of health questions that come up at Ice Bath Club.
I know, and so thank you for actually letting me bring you into this room and having an actual conversation with you about health, especially one that's really close to my heart, breast cancer today.
Of course.
Well, before we go into all that exciting conversation today, I'm going to ask you a really tough question. Is that okay?
Go for it.
You failed many times in your life, haven't you?
It's kind of a harsh assumption, but the answer is yes. And I think anybody who hasn't failed is failing when they answer the question. It's the scale or the frequency of failing that's probably more insightful. I think I was a little bit late today, and that was kind of a fail. I was doing a swimming competition earlier this month, and I was very late off the blocks. It was a total fail, but the race was a total success. So I think you have to put failures in context of objectives. And then, it's how do you frame it? Is it really a failure? Is it a learning opportunity? Was that part of resilience? An interesting thing about failing, Silicon Valley, sort of thought process is if you have a failed startup, that's a badge of honor. But in Asia, a failed startup might be bad luck, or it wouldn't be regarded as a learning curve. It would be regarded usually a little more negatively.
Yeah, I mean, the culture of failure here is not celebrated as much as the culture of failure in parts of the West. And so when we think of high performance, right? Failures, high performance, different cultures, how does that fit for you, having your experience both in East and West?
First, how would you define high performance? Where are we going with high performance? What is that? How fast you run? Is it how good of a parent you are? Is it, what does performance mean? And I'll probably say this a lot today, but it's the context. And I think that our cultural context or our medical context or health context is critical to understanding how you answer the question of what high performance means. The goals and the context first sort of reevaluated for me as I take care of more healthy people who don't want to get sick, as opposed to historically when I was just starting out in medicine, I wanted to be a cancer doctor. was either cancer or cardiology. And part of the allure was I wanted to take care of people who had an obvious problem, fix that problem, and move on. And if you had asked me 30 years ago, did I want to be a family medicine doctor thinking about blood pressure and cholesterol and low back pain, that was not my interest. I really wanted the acuity of a quote serious problem. And what you realize is the goal of a cancer patient, you don't have to ask. They want to be cured. They don't want to die. They don't want to suffer. But as I transitioned into taking care of people with a history of cancer or family members of former cancer patients who are healthy, then you have to start asking, what's our goal? Is it live longer? Is it live better? Is it health span? Is it lose weight? Is it have more energy? Is it run faster, swim faster? So performance is all relative to the context.
I love that. And that is so true. I think every single guest that we've brought in here has a very different definition of what performance means to them and for people around them. And I especially love that. So one thing you touched on earlier, which was how you've shifted, you know, subtly, you've touched on it subtly, how you've shifted from where you originally started in medicine and to where you're at today. I mean, one of the reasons why I even came to you in the first place was because I felt a need to check in with where I am at today health-wise versus where I was 3 years ago, where I actually did breast cancer detection test to see if I had the markers for breast cancer. These are the patients that you see today?
So I think you're talking about like the DNA testing, germline, the DNA you get from mom and dad, and whether or not you have a gene variation, a misspelling. We all have the same genes, but sometimes those variations can predispose to a greater or lesser risk of cancer in lifetime. The most famous, these BRCA genes and some other similar ones, predispose to a higher lifetime risk. And I take care of a lot of those patients. The thing about Asia is that when you earn trust, when you take care of a patient, a matriarch, the 65-year-old mother, and you've done a nice job helping them not just get over their cancer, but be more holistic, and not in a woo-woo holistic way, but in a comprehensive, integrative, I'm going to look at your health comprehensively. We've beaten the cancer issue, but now there's heart and there's cognitive and there's mobility. When you begin to think about the person as a whole, that breast cancer patient says, would you take care of my spouse? Will you take care of my children? Those cancer patients may have a gene. We'll take a family history and we might see, with or without a gene, someone has higher than average risk. And that risk stratification allows us to do risk adapted. I know it sounds very technical, but it's basically personalizing health screening or health care so that we can avoid medical intervention. That's really where I started to make the shift, and seeing these families that almost by definition might have a higher risk of cancers, but we also see so much heart disease and so many other common medical ailments that we've built an entire practice with family medicine doctors and other specialists taking care of patients who have never been sick, risk stratifying them, being able to take care of the acutely ill, like a cancer patient, curing them, monitoring them, and then making sure nothing else bad happens in their lifetime. So it's really holistic and integrative, a spectrum, a lifetime of care.
I especially relate to this matriarch model where, you take care of me and my health, and I want you to take care of everybody else around me. So at the same time, what I've also heard is there is some level of predisposition risk based on genetics, but it might not necessarily come or express itself. Is that right?
So yes, if a patient is found to have a gene that is a predisposition, we can say, at least statistically, this gene may be associated with a 70% increase lifetime risk of breast cancer. That's also a 30% lifetime risk. It's not going to happen to this person. And I like to say DNA is not destiny. There are lots of people who have so-called risky genes, bad genes, and nothing unfortunate that the gene would have predicted will ever happen to them. And so you have to take that risk factor in account with other risk factors, because the biggest risk factor for cancers remains tobacco. And after tobacco, the number one cause of preventable cancer is obesity. So if you really want to identify people at elevated risk, then you have to offer them risk reducing strategies, which would be, okay, well, there's the diet and lifestyle piece. There's the exercise piece. There may be medications to lower risk as well. And everything has a risk benefit approach. And how does that, my offering, how does it jibe with your personal values? So I think that our job is to give you opportunity to reduce your risk or to optimize your performance. In this case, it's performance to avoid preventable disease.
You've touched on something really important here. So there was a lot. At the same time, I've distilled it down to, okay, you're saying there's nature versus nurture. Nature is what I currently have today, but may not express itself. Nurture is what might happen to me if I do not take care of what I eat, my lifestyle, the stress levels around me. Now, as a woman, I'm going to call it out. I'm a middle-aged woman, right? I am turning 40 this year. I was managing a big team across Asia Pacific, multiple different time zones, working on global projects, traveling 70% of the time. I'm not singular as a person doing this role. There are many other women like me who have very high stress jobs. We have families to take care of. We are sandwiched between, especially as an Asian woman, our parents, our grandparents, at the same time having to take care of our kids. So there's a lot of stress that we deal with.
You can't win.
Thank you.
Right?
Thank you.
You're right. Yeah. No, the burdens remain uneven, and the expectations for women are, unbelievably high. I feel a similar empathy for high school students today who are supposed to start a charity, do extracurriculars, get great grades, go to the right school, and then we come in and say you have to get more sleep and stop playing video games. So you can't win. How do you manage it?
Yeah, that's going to be my next question. It's how do I manage it? Give me a formula. I mean, I'm all about formulas to help optimize my performance. So give me a formula. What's the right way?
What's your goal? You have to define the goal. And I think when someone comes in as a new patient or even as a new family, we can do what people would call health screening. You can go to the public sector, the private sector, you can go to other countries, go get the information. The data is all the same, your blood work, your heart test, etc. Then we have a sort of a biological profile. Maybe we're going to add in your Aura Ring, your Whoop, your, some
Apple
other,
Watch. Something.
other data, pieces, and we're going to define you in a kind of contemporary digital way. And we're going to say, you're not sick. You're not broken. Okay, that's how you came in. You don't have any medical issues, but you feel exhausted. You feel stressed. You're working hard. You're performing well, I bet, right? When you're doing 70% travel and pitching to clients and bosses, nobody knows you're jet lagged, right? And you would probably tell me, I don't get jet lag. Great, that means you're a good performer. But your body feels the toll and it begins to add up. The question will be, though, what are you trying to achieve? What's the goal? You could say, I'd like to earn X money by this age and retire. Okay, we're going to keep doing what you're doing. I may offer you medicine to protect you from your risky lifestyle, just like I would we would offer an astronaut a really great spacesuit because they're going to get so much radiation. But if they can't be an astronaut, if their mom says, "Oh, you shouldn't be an astronaut. That's really dangerous." That's not going to make the astronaut happy, or the race car driver. You have to wear your seatbelt. So there are ways to help reduce the risk while you have an aggressive lifestyle. But you still have to tell me or someone what you're trying to achieve. And maybe you can't do everything at once. It's a little bit of these ideas of what's the strategy and what's the tactic. Because the strategy is over years. And the tactic is, what are we going to do right now to help you achieve that goal? So I need to know what you want to achieve. Then I've got a whole list of interventions, whether it's diet, lifestyle, exercise, medications, complementary therapies, uh, uh, lots of different choices. But what are you willing to do?
Oh, I love that. So I think the one question for me is there's a lot of these trends, tons, right? We talk about, for me, 5 a.m. club, you have this people who have a certain routine. You have I don't want to make decisions around clothes. I want to do contrast therapy. There's high rocks. Oh, I'm so pressured to do all of these things. I feel like we might have jumped the gun a little bit, but this is extremely relevant to my last question because I'm just a normal person, I like to believe, who is just trying to live better. But I'm always being bombarded by trend after trend, whether you want to talk about contrast therapy, whether you want to talk about high rocks, whether you want to talk about the new multivitamin.
What is live better?
For me,
Yeah.
to be able to, at 80, still carry my groceries.
So your goal is health span.
My goal is healthspan.
Health span is a common term today, but longevity is one of the trends. And I'm an optimist. I hope that we can live to 120 or 150. And in my sort of strategic futures, health futures thinking, hey, if we can live 20 more years really well, and it's going to be 2045, I think sky's the limit as far as what longevity could bring us. But to be pragmatic today, I don't see longevity. I see barriers to longevity, but not to health span. I think that you and I, if we make good choices now, are going to be physically nearly the same at 80 and 90. And what year will that be? That's going to be 30 years from now, 40 years from now. So it'll be a very different world. So again, strategy is to maintain ourselves. The tactics are basics, and sometimes they're boring. It's consistency, and there are a lot of people who like novelty. They want something. We're humans. We love novelty, but consistency is really key to performance. You've got to have some routines and rituals that help you keep an even baseline in a world where there's lots of ups and downs. Those ups and downs come from family, that there can be a new child born or a parent dies. They're both stressful, but your body doesn't know the difference between good stress and bad stress. You could get a promotion, but that's going to require you to work more. If the goal is to earn more money, this is good, but what's the cost of the extra job responsibility? You could do high rocks because it's so much fun, you're competitive, it's great for your mental health. But what if you injure yourself and you can't do any exercise? So you have to find a balance in your tactics that doesn't prevent you from hitting your strategic goal.
So I'm hearing trade-offs, making decisions about
Always
trade-offs.
a trade-off. Here's my trade-off. Over the years, I have played with different dietary manipulations that I've offered to my patients so that I could say I've walked in your shoes. And whether it's low carb, slow carb, no carb, paleo, keto, carnivore, fasting, intermittent fasting, vegetarian, vegan, pescatarian, I've done it all. Usually for 6 to 8 weeks, wearing a glucose meter, doing blood tests all the time, wearing multiple watches, my Garmin, my Apple, my Aura, my Whoop. Guess which dietary choice made me feel the very best?
Pescatarian?
Vegan.
Is it?
Vegan was surprisingly comfortable, and just little niggling things, runny noses or sore thing, all went away. But I am definitely not a vegan today because of the side effects.
What are the side effects?
I lost so many friends. It is socially difficult to be a vegan in Singapore. And we support, we say that we have culturally appropriate nutritional support in our office. And we whatever your choice is, but it has trade-offs. It's really hard to get the adequate protein that we think people need today when you're on a vegan or vegetarian diet. But we're not going to change your values. And the values are important when it comes to what the tactics are. Because we're not there as a practice, or me as a professional, to change your values. I'm a trusted guide or advisor. You tell me the rules and the limitations, and then I'll give you the optionality and the risk and benefits.
You've just touched on something really, really important. Values. So if I was to come to you today and say, Dr. Tucker, I have XYZ goal. I don't care whatever it takes, just get me there.
Mm-hmm.
Would values be a question you ask me around, like, what's your value system?
I don't think we ask the value question as a direct statement. It's something we infer. For example, if someone comes in and says, a common request is people want to lose weight, right? And they really don't necessarily understand that what they're talking about is losing risky body fat, because no one wants to lose bone mass and we don't want to lose muscle. And then I get to, do you really want to lose weight? Or is there a certain number on the scale that you're trying for? Or is it you want to be a certain clothing size? Do you want to lose weight to run faster? Because then I'm going to say, all right, let's go to the plastic surgeon if you want to be a size 2. Or if you want to run faster, let's go to a special gym that's great with running. So you have to find out, and that's where the values come in, because some people say, no, I want to do it naturally, or I want to take medication, or I'm worried about the risk and benefit of the intervention. And that's where values come in, is what are you willing to do or sacrifice to help achieve your goal? That's kind of the values I'm looking at. I mean, I have patients who come in and they want every pharmaceutical that we have in cardiovascular, metabolic, diabetes medicine, because they have terrible lifestyle choices. But those choices are required because they're in sales and they feel like they have to go out drinking with clients 5 nights a week. And they know it's not good for them, but they also know it's not forever. It's the risk they're taking for a window of time, and they want to protect themselves to the extent that they can.
Do you think that it is sustainable for someone to be going out doing sales? Let's say a banker. I mean, we know so many bankers, right, who go out, do all these sales in the middle of entertaining their clients. I mean, they are probably same age as me, mid-40s. And then I see them the next day doing a sauna, detoxing everything. It's like the play hard, work hard kind of, or rather, no, it's the work hard, recover hard model. Do you think it's sustainable?
I think it's all personalized. I think that depends upon the family unit. If you're single, that might work really well. If you have a spouse and 2 kids and they expect you to, make breakfast and drive them to school and be there for a recital in the afternoon, and you're training for an Ironman triathlon with 18 hours a week of commitment, something's going to have to give. But sustainability all depends upon the resources you build around you. And so I think it is. I think most people, as time goes on, they change their interests. Their focus changes. So maybe they don't need the novelty of triathlon anymore and they move into yoga. They move into more time efficient activities. Uh, so many people I know have reduced or given up alcohol as they age. And I don't think my parents' generation did that. I think that alcohol was a consistent social lubricant that everyone enjoyed. I enjoy a glass of wine, but I drink significantly less alcohol these days. Wine groups and things along those lines, and wine and food, because my priority is sleep, and alcohol kills my sleep. And if I don't get good sleep, I can't wake up early. And if I can't wake up early, I can't go swimming, which I want to do every day. And if I can't go swimming, I feel like I'm not going to be good at my job. So it's really important for me to make those decisions in the evening and late at night so that I can be the best version of me in the morning.
And that's your definition of performance, being the
Yeah.
best version of yourself.
Doing my best to show up every day in my best performance and being, for my job, I have a great job. I love my job. I meet 2 or 3 new people every day, sometimes at a horrible time in their life, sometimes like you. And I'm in a good space and I want to stay in a good space. But I also get to see 8 to 10 people who I've known for years, if not decades, who come back to see me every 3 to 6 months and tell me, here's how my life is going, and you get to catch up. So I need to be there every day listening. This is very different for me. Talk, talk, talk. My job, and I think the job of every doctor, is to listen. The art of healthcare is listening. The art of medicine is prescribing. And I think healthcare is where the future goes.
People don't listen enough.
Exactly. You let people talk. It's so much fun in the office. We devote time for patients. We have long visits, and you'll come in and I say, "Tell me why you're here." And it's talk, talk, talk. And we just let you talk. And you go and you go, and then you realize you're the only one talking. And so you say, that's it. I'm like, "Is there anything else?" And you think, "Oh yeah." And then you're going to tell me more, and you keep talking. Okay. And we listen. We look, I see the clock. It's been 5 minutes. It's not very long. But when else do you just get to talk? And then I'm going to say again, "Is there anything else?" And you'll say no. And then I'll ask you a question. You're like, "Wait, one more thing." And you go again. And we haven't given you all that much time, but that's the whole luxury. Tell me your life story. I call it the interrogation. I want to know everything about someone, not because I'm a curious person, which I am, but I need to know the context of why you've come to see me. And you don't realize that maybe what you did when you were 25, when you lived in Hong Kong and you got tonsillitis over and over and over, which means you got antibiotics over and over and over, that's going to tell me something about the irritable bowel or the anxiety that you have today, 15 years later. So you really need to know someone and go back to, where were you born? Where did you go to school? So it's a great job.
Now I understand why I was in your office for so long. It was very awkward, actually, because I remember for me, this Dr. Trisha, she was asking me a lot of questions, and I was like, why are you asking me so many questions? And now I understand she was actually building a picture.
Right. Being in Singapore, we meet a lot of really fascinating people. And so asking someone When were they born? Where were they born? That may have nothing to do with where they are today. A typical patient is, oh, I was born in London. And then I'll ask, did you graduate university, high school in London? Oh, no, no. When I was 8, I moved to Kenya. And then they lived in Kenya for 4 years. And then it was boarding school in the US and then university back in London. And of course, then they went into banking. So then they lived in New York, but then they moved to Hong Kong. And then they moved back to San Francisco. They left banking and they moved to Bali to relax. And you realize they've been all over the world, which then means, did you get any, you've lived in Africa. Did you have malaria? Did you have, their stories and experiences shape their health today, which shapes your risk for obvious and preventable disease. And then we can say, here's where you are. Tell me where you want to go, and we'll give you a plan. And the plan will change. So, this year you want to swim faster. Next year, you may want more energy to do an IPO. The year after that, you want to focus on sleep. Tell me what the goal is, and we will lay out the opportunities and tools, the tactics, and see what fits in your lifestyle at the time.
That is so personalized. I love it. I always thought, being growing up for me, right? Going to the doctor, going to the GP, it was like, oh, I'm sick. Okay, here are 3 medications that you need to take. And it's always the same 3. I only know it because it's the same color.
Right.
And that's what I always thought about medication.
And that is medicine. And there are a lot of people who criticize medicine today because it's very prescriptive and transactional. I would point out that where we talk about, oh, it's a sick care system, we need doctors for the sick care system. I want someone there if you get pneumonia, if you get a broken leg, if you need a kidney transplant. So it can't all be about wellness, longevity, and lifestyle. We need physicians who are going to take care of the sick. But what we need are physicians, providers, maybe not always a physician, but somebody who has a relationship with you and your family that knows the history and can put your health in context of your acute medical episode. That's really the key. Our breast cancer patients come in with an emergency. Breast cancer at diagnosis is not a physical emergency. Women, we don't send women to the emergency room and say, stat, I need chemotherapy and a lumpectomy. It's an emotional emergency. The C word still holds so much power over everyone. And what we need to do is diffuse that emotional component, talk about here's the methodology to cure breast cancer, early breast cancer, stage 1, 2, 3, very, very, very high cure rates, something that we can manage and then call cure. It's a lot of work, but the system works well. When you're over that acute phase, that's when we start talking about, hey, maybe we need more exercise. Maybe we need better sleep. Maybe that job that you had created a lot of stress that wasn't great for your health. It didn't cause the cancer, but it created an environment where it was easier for that risk gene to sort of take hold and do what it wanted to do.
You've touched on something really important for me, and especially because to cancer at this stage, my dad has leukemia, and I shared this with you earlier.
He's doing better.
He's doing better, I hope. He's got his chemo round 2 as we speak today.
But emotionally,
he is better. And there was one thing I think that I believe helped him big time, which was, one, he always showed up no matter what. Every single day he would have a shower and he would comb his hair.
He's brave.
What little hair he had. And he would shave. No, even though the doctors told him not to shave, he would shave. And I think just showing up for him was prompting him that he had a purpose, that he still had something to live for. And he was in the hospital for almost 3 months in a room. And I don't know how he did it, but I felt personally that he was taken hostage. That was just me. This is my perspective. My perspective, he was taken hostage. But he did not allow himself to feel that way. In fact, he overcame that in his mind, though there was an element that really changed something for him, which was when they moved away from the IV poking
Right.
to putting in the central line.
Right.
And that was a switch on for him, because I could see there was a moment where he was close to feeling really defeated.
Mm-hmm.
And when that central line went in, his face in 2 days completely lit up because he was no longer getting poked.
That's fascinating. It's a good example because, well, one, I mean, he's brave, he's strong. I love the shaving because it's this daily act of rebellion that shows he's making his own decisions. And a diagnosis of cancer or any chronic illness, dealing with the medical system, which is so horrible, it's not that it's dehumanizing, parts of it are, but you're being bossed around and you lose control. Cancer is loss of control. I was in charge of my body and now it's rebelling. And I'm an adult. I can decide when I want to eat, go to the bathroom, leave the room. And now my family's telling me I can't. The doctors are telling me I can't. The nursing assistant tells me. Everyone is bossing you around and treating you like a child. So I love the act of rebellion. It's interesting that the placement of the portacath gave him inspiration, because I could also see it going the other way, that having a semi-permanent intravenous access device for some people is a daily reminder of not being healthy. That I have breast cancer patients who have a portacath because they need a year of preventative chemotherapy. They can't wait to have that removed because it is a constant reminder of the worst episode in their life. Let me give you a side story on something completely fascinating, unexpected results. In the US, in a lot of places, after women with breast cancer complete their preventative or adjuvant chemotherapy, someone will ring a bell. There will be a celebration. Everyone will go to the courtyard. They ring the little bell. They enjoy cakes or cookies or healthier food. That seems like a lovely ceremony. Someone asked the question, is this a good idea? And they did a randomized study comparing celebrating the end of their chemo program with the bell to not celebrating. And it turns out ringing the bell is Pavlovian, and it can signify that time and make it permanent in your mind so that you've now memorialized the worst 6 months of your life. And that when you hear the bell ring in the future, it's a negative reminder. And while that study on average showed it's probably not a good thing, you still have to personalize, because like your dad, getting a port was awesome. But for someone else, it's this horrible reminder that they've sort of had to submit to a medical episode, go into this foreign world to be kidnapped, held hostage by the medical system until you can be a free man and walk around and make more choices on your own. So I'm glad that it's positive for him, but it doesn't always work out that way.
Yeah. And what you've just shared, like, I thought, wow, celebration, that's amazing. Like, for me, that's me rewriting my own program of what that is. And this was something that I think it's coming to me more and more about high performers. Why are they always so happy? Have you noticed this? They're generally very positive people who are a little bit more. I mean, for me personally, I I associate someone who's high performing as someone who's positive.
You're a positive person. You're an enthusiastic, seemingly extroverted, happy performing person. You may attract that environment or you gravitate to that environment. I think we're generalizing. Again, I get the opportunity to meet 60 to 70 people every week. I can recall a patient 20 odd years ago before I moved to Singapore, maybe around the year 2000, early 2000s, when I worked in Los Angeles. And I took care of someone who worked in Hollywood, was a writer, and it's so paradoxical because this person wrote for comedy and, like sitcom humor. The most pessimistic, sort of miserable, just this typical, almost like Dostoevsky, like like life is horrible. Yet he was a really, really funny writer. And when he would come in and he had a metastatic cancer, he would look at, a glass of water and he would always say it was half empty. And he would say, and there's stuff floating in it. It looks kind of dirty. I mean, there was no positivity in this man. And his daughter said, "Doctor, you've got to work on my father's attitude. He's such a pessimist. Isn't it better that he has an optimistic view?" And I told her, "No. He's dealing with a cancer and all the control issues or loss of control. It's the biggest, quote, battle of his life. And now you want him to change his personality? That's a big ask." I said, embrace his pessimism, embrace who you are, and enjoy your life the way you've been. It's like when somebody's been eating, I'll even call it an average diet, and their spouse says, "Oh, you should be a vegetarian now. You need to eat organic now." Again, you're dealing with this big burden, this challenge of cancer, and then you make a change. That's even more things to deal with. So I do agree. A lot of performers I meet are positive, and I think that there's increasing evidence, although I would call it weak evidence or observational evidence, that optimists in general do better than pessimists across a variety of domains, which is not to say they get an advantage. We can't say that optimists, for example, say live longer. Maybe pessimists just live shorter. There is a small difference between the two, but on a personalized level, you have to know who you are, but you also have to ask, how's that working out? Is this working for me? And is there a way that I can make a change sustainably that is going to help me achieve my goal?
What I've heard from you today is a lot. I'm going to try to sum this up. But essentially, having a clear goal is very important to how we want to live our lives, right? And then working towards that goal, both strategically and tactically, having the rituals. What I've also kind of heard is a community
Yes,
support system.
absolutely. We are social creatures, social animals. We do better in a pack than we do on our own.
And the support that you've allowed your team to be there as well. So the community of the family, your friends, the support system that you have as well.
Absolutely. I mean, for my work in the office, it's all about the team. If I didn't have the nutritionist and the nutrition coach, the nurses and the oncology nurses, the administrative staff, the patient concierge and coordinators, we would be lost. The physicians are only one part of the team. And we think of the way Tucker Medical practices as a so-called flat organization. We do a weekly multidisciplinary meeting, which includes everyone of every stripe. And it's very equitable in terms of, okay, we're going to listen to the physiotherapist and my gastroenterologist is listening and paying attention. And when our external psychiatrist is talking, the administrative staff are picking up on clues about how new patients call in with anxiety. And so we share and learn from each other at every station in the office, but it's really important that it's one cohesive team with one goal, and that is to help the people who come in navigate a medical or health visit without anxiety, with comfort, with privacy, and reassurance.
Oh, I love that. And it's so important to have specifically that reassurance and that also the curiosity to learn from each other.
Yeah. Building out curiosity and getting people to ask questions. It's sometimes a challenge. You just have to create a safe space for people to express themselves.
Yeah, and it's so important because that allows for that listening. And earlier you talked about in medicine, you have to listen.
All about listening. Absolutely. Yeah,
Well, I have another hard question for you.
sure.
So AI is the big topic du jour, right?
Yes, sure.
How is it currently supporting you in your field today and how you practice?
Well, I'm an AI construct. I'm not really here today. I'm, yeah.
We're in the matrix.
Yes, exactly. This is a simulation of Steve Tucker. Uh, we have been very technology forward since I started the practice in 2011. As an aside, we were the first people to bring Fitbits into Singapore.
I did not know that.
There is a generation, just like there's a generation that doesn't know how to dial a phone, or, a rotary dial. There are people in the world who have never heard of a Fitbit. They don't understand what it was. I've still got some samples, but a little tiny pedometer, the whole step count thing from that. And we've been technology forward. And I've been working on the periphery. I would say I dabble. I have a lot of varied interests, very broad, less deep at times, but AI and different versions of AI before the current language model explosion is something that we've paid a lot of attention to, for me personally, or in medicine. The current versions are absolutely game changing. They're game changing in many, many ways. I think the easy conversation or controversial is, will AI replace doctors? And I'm gonna table that for a second. But what else is AI gonna do to make medicine better? AI can handle the front end, all of our scheduling, all of our forms, all of our pre-authorizations. That can all be done agent to agent in advance. Second, what does it do in the office? Let's assume that it's not going to replace my cognitive skills, which it will, or augment or co-work. But in the office setting, I no longer have to type. I no longer have to put down all these details in some way, because I can have a virtual ambient scribe, both have a transcription for exact details, but a summary that can be sent to you, where I can automatically send a referral. All of that paperwork gone. And then on the back end, all of our security, whether it's drug inventory or privacy, insurance, the tools that we have that then become AI augmented remove a lot of drudgery, improve efficiency, and enhance safety in something as personal and private as medical or banking, similar sorts of fields. So if AI is doing all of this, what am I doing? And I think that AI today, if you're going to talk about AI replacing doctors, first thing we have to do is say, are you a doctor who does procedures, or are you a doctor who just talks all day like me? Okay. And procedurists, I'm going to ignore for the moment, because I don't see in the next 5 years AI robots doing appendectomies. I see people using robots to do appendectomies, but no one's, it'll happen. In the same way that you get in a driverless car, you'll get on a driverless operating table at some point. But that's not in the next 5 years, maybe even not the next 10 years, to be a driverless surgeon in that sense. But on the cognitive side, I know that AI systems make me a better version of my professional self. My communications have never been better. Meaning the documentation that I share with your doctors, the ability to think and recall less common conditions or concerns, the ability to pull together 10 years of laboratory data to identify a trend that maybe we wouldn't have seen manually. I think that that's absolutely changing the way physicians will work. I think we will always need physicians. We will always need hand holding. We will always need trusted advisors, but you'll want a trusted human advisor who has pre-chosen the best tools to make them better at their job. I don't think you want a pure robo investment tool. I think you want a professional who knows how to use the tools for your personal goals. So AI has been game changing, and as conservative as medicine can be, I think that the adoption is actually quite high, even though there's a lot of, I would say, secret users. I think, especially in the States, there's a lot of AI usage that is not being reported. Physicians are sort of doing things on their phones and then dictating or putting it into their charts because it's not enterprise all the time in the hospital systems.
Yeah, so what you've just touched on was going to be my next question surrounding privacy and confidentiality, which is the thing we just spoke about earlier with your team. Briefly, share with me the medical ethics around that.
Well, I don't think it has anything to do with medical ethics. I think these are privacy, whether it's PDPA or it's the subsequent versions of Singapore's Privacy Act, or in the U.S. it's HIPAA, Health Protected Information. I think there's a regulatory environment that is respected, and that's quite straightforward. Whether it is the guidelines or law, this is what we do. I think confidentiality is the way that if you come in, you and your husband come see me. Often, a couple will come see me for a new patient visit that they want to join Tucker Medical as a family. And so over, 90 minutes, I'll get your story. I'll get the spouse's story. We will talk about the blood test to be done and arrange a follow-up visit. 5 days later, you come back, but without the spouse. And we review your results, and you ask, can I just get a copy of my husband's labs? And I'm like, no, you may not. Unless we have pre-specified that you have the right to this individual's information, we're not going to, do that. Very often, I've been very fortunate. Our practice has really been built by word of mouth over the last 20 years. And someone might walk in and I'll say, oh, great. How'd you get here? How'd you learn about me? And they'll say, well, Nina, sees you and said that you were really wonderful for helping achieve her goals. And who's Nina, right? But I don't know who this person is asking about your health. And so we just smile and move on. I don't, they say, no, she really referred me. I'm like, if you say so. And then we move on. So confidentiality is very different than the data privacy piece. So one is respecting what is the legal and regulatory environment, but it's medical ethics is confidentiality, that we don't talk about your problems to anyone else without your permission.
I appreciate that very much. Thank you very much, Dr. Tucker, for today. I really learned so much around not just how to manage my own health. I learned a lot about the goal that we all need to set, the rituals that we need to put behind our strategy and our tactics on a day-to-day basis, the trade-offs that we need to think about, the people we're going to surround ourselves with, and also the future of AI and medicine and how you're both interconnected. This has been fascinating. Thank you so much for your
Thank
time.
you. If it's okay, I want to finish with a sort of a reminder. We started this and we talked about this for Breast Cancer Month. And I would put in, as we end this talk, to frame what we've just talked about in the context of the women who come to see us, whether it's for a mammogram for screening or a new diagnosis, and how we will help everyone who's been diagnosed, and they will do well, but it's an episode. It might be 6 months, it might be 5 years, but as frightening as cancer is, we want everyone to understand that this is a problem that will be fixed, but it's in the context of a greater health. And we will begin to ask those patients, those women, obviously the goal is to be cured. And we will do that. I have every confidence in that. But after you're cured, what's the goal? You know, we could say you'll never get breast cancer again. Double mastectomy, that's gone. But what about a different kind of cancer? What about Alzheimer's? So how can we reframe? And reframing is the key. How can we focus and reframe what health means to you, and then give you the tools to get there? So I would like to bring it back to that breast cancer awareness and to let women know it's a difficult process, and we understand that. They're overwhelmingly going to be cured if they follow the guidelines, but then rethink, what does it all mean, and how can I live the best version of myself?
You've heard it directly from Dr. Tucker. Dr. Tucker, thank you
Thank you.
for giving us both hope and a plan.
Happy to be here. I look forward to doing it again.
I can't wait to bring you back. I have so many other questions for you. So thank you for joining us today. As you know, this is Breast Cancer Awareness Month. So take action, book your screening, talk to your loved ones, and make prevention part of your routine. Your health is your high performance. Stay high agency, and we'll see you next time. Bye.